Mr. Speaker.
Order. Questions for oral answer. Mr. Yip Hon Wing.
Mr. Speaker, sir, with your permission, may I address the questions for oral answer 1 and 2 and questions for written answers 21 to 23 in the order paper, please?
Please do.
Thank you. I'm very thankful that the number of questions on COVID-19 has reduced significantly. Mr. Yip Hon Wing asked about COVID-19 hospitalization rates that our public hospitals can accommodate. As our society becomes more resilient to COVID-19 due to vaccinations, as well as safe recovery from infections, we have observed that the incidence of hospitalization has fallen in the most recent Omicron infection wave compared to previous waves. However, it is not possible to estimate a hospitalization incidence rate which our healthcare capacity can accommodate or can handle, because this is also a function of the transmissibility of the variant and the number of people who get infected on a daily basis during a big wave. So what we need to do is to continue to keep our vaccinations up to date, prevent ourselves from falling severely ill if we are infected. We must exercise social responsibility, such as staying at home and self-testing when not feeling well, and do whatever we can to optimize our hospital capacity. And we have been and will continue to reallocate our healthcare resources on a dynamic basis to where it is needed most. Mr. Yip also asked about vaccines. We are bringing in bivalent vaccines into Singapore. It is provided for in our agreements with the pharmaceutical companies. HSA, the Health Services Authority, has in fact completed the evaluation of the Moderna bivalent vaccine, and the decision will be announced soon. The bivalent vaccines will target both the ancestral strain of COVID-19 and the Omicron variant. Our intention is to update our vaccines for the National Vaccination Programme as formulations improve. We will share more details when the arrangements are confirmed. Nevertheless, existing vaccines, they remain highly protective against severe disease, including for the BA.5 variant. If you are eligible to receive another vaccine dose, please receive it without delay and not wait for variant-specific vaccines, because COVID-19 is still spreading in our community. I will now turn to the member's question about COVID-19 in children. As of 29 August 2002, amongst young people aged under the age of 18 who are infected with COVID-19, the incidence of MIS-C, which is the multisystem inflammatory syndrome in children, was 5.7 per 100,000 for those fully vaccinated versus 38 per 100,000 amongst those not fully vaccinated. 5.7 versus 38. The member also asked about children's vaccinations for COVID-19, such as whether Novavax will be made available for those aged 18 and below, and whether the vaccines have long-term effects on children. Currently, HSA, as well as our expert committee on COVID-19 vaccination, are independently evaluating the COVID vaccine, the Novavax vaccine, for young persons aged 12 to 17. Novavax has not submitted the application for its vaccine to be administered to children under 12 years of age. There is so far no evidence suggesting COVID-19 vaccines result in potential risk of toxicity to humans or developmental defects in children. There are no plans to include COVID-19 vaccinations into the National Childhood Immunization Schedule at this point. As the pandemic situation is dynamic and recommendations continue to evolve with new data, MOH will review this when appropriate. Associate Professor James Lim asked about vaccination differentiated measures, or VDS. At the height of an infection wave, measures are taken to prevent healthcare system from being overwhelmed. However, when cases are low and steady, many of these measures, including mask wearing, for example, have been removed. However, others, such as vaccinations and VDS, are kept in some form in anticipation of another infection wave. And this is the nature of crisis management. We stand down many measures when it's not needed, but we need to keep some in anticipation of something worse happening later. So while VDS are mandated for specific settings such as events with more than 500 participants at any one time, business owners and employers also have the flexibility to implement conditions of service that are relevant to their settings, such as requiring the donning of masks, as well as adopting vaccination-related instructions for customers or for workers. Nevertheless, as the MTF have explained in our last press conference, we are reviewing vaccination requirements from one of counting number of doses and boosters we are taking to ensuring that our vaccination is up to date. And this will be a more enduring posture as we live with COVID-19 as an endemic disease. We expect to complete this review in the next couple of months and will review VDS at the same time.
Mr. Yip Hon Wing.
Thank you, Mr. Speaker. I thank the Minister for the reply. I have two supplementary questions. I note the Minister's response on adding COVID vaccination into NCIS. It will give assurance to parents that the COVID-19 vaccinations does play an important role to better protect children against severe complications such as MISC. What else is the Ministry doing to encourage more parents to vaccinate their children for COVID-19? That's my first SQ. Second SQ is, when will MOH allow children below the age of 5 to get the COVID vaccination, since other countries such as the US has allowed COVID-19 vaccines for babies aged 6 months through to 4 years? Thank you.
On the second question first, children under 5, we have the supplies. It's part of our supply agreement. We have also approved, HSA has also approved the use of children vaccine 6 months to under 5 years old for the Moderna vaccine, which is a 2-dose vaccine. But because cases are now low, and children are also, and we're looking at the age group, where children, we also want to do children below 5 and booster for children 6 to 12 at the same time, at the same location. Then it's more convenient for parents to bring siblings, often falling into both age groups, together to the vaccination center. But the older children, older age group, they are in primary school. Many of them are also getting into examination mode. And given that the current situation is stable, cases are relatively low, our intention, as we have announced in our last press conference, is to time it around end October or early November when examinations are over, and then with peace of mind, parents can bring their children both from 6 months up to 11 years old, either for their primary series or for their booster. So that's our current plan. Details will be announced once we are ready. And as we open up vaccinations to all these children, or booster or vaccinations, we want to continue to disclose as much information and medical information as we can. As the member have asked, what's the MISC rate for children who are fully vaccinated and not vaccinated? And we can tell there's a huge difference. So therefore, it is through encouraging parents through transparent information that we hope more parents will bring their children to get themselves vaccinated.
Associate Professor James Lim.
So I understand the desire by the ministry to allow the private sector to retain maximum flexibility in terms of vaccine differentiated measures. But I'm wondering if the public sector will move toward a complete removal. And I ask in part because I believe many of us still have residents that for religious, health or personal reasons who have chosen not to be vaccinated?
I think it's difficult to give a blanket, to adopt a blanket policy to say all public sector shall not insist on VDS. It all depends on the settings. Each setting, it depends on whether it is crowded, whether seniors are present in those settings, what is the risk of transmission. So I think we always need to take a differentiated approach. We must remember that as we increasingly treat COVID-19 as endemic, endemic doesn't mean that it's not there. Endemic means to acknowledge that it is there, and we have to adjust to our normal life and normal procedures in order to live with the virus. And one of the principles to do so is to make sure that according to the risks of different settings, we adopt the necessary measures to manage the risk. And so therefore it is in this spirit that we allow employers and building owners to impose their own VDS requirements should they need to. Nevertheless, as I mentioned in my main reply, we are reviewing VDS together with the requirements for vaccinations, and it should be completed in the next couple of months.